So I said, look, let's do an experiment. Let's take a piece of steak, muscle. That's your muscle that you're trying to build up, right? Pour sugar on it and just come back in an hour and see what happens. Like what happens? It turns to mush. I mean, that it's a tenderizer, right? And
Mm.
so for your teenagers.
Today I spoke with Dr. Elisa Song all about kids' gut health. She's a very qualified person to speak on this topic. She's a conventional medical doctor trained at Stanford, NYU, UCSF, and has done a tremendous job integrating natural therapeutics into a pediatric model. So for those parents out there who want to optimize their gut health or their child's gut health and reap all of the benefits that are metabolic and neurological and developmental in nature, she is a great resource that can help you steer around things that are deleterious, like early use of antibiotics and processed food, and give you guidelines for natural therapeutics that can be used in their place, and also dietary strategies. And what I really appreciate about her approach is that for kids and for teens, she's framing these in a sort of gamified and fun way rather than a pathological, sick, avoid these things because they're bad, but rather what things to focus on as we're trying to make you healthier. So just a fantastic approach. She's here to discuss her new book, which is chock full of resources. And I hope you enjoy the conversation as much as I did. Hey, everyone. I am back with Dr. Elisa Song. And this is time 2, appearance 2, all about gut health with a focus on children's gut health, which is so, so important. Love the work that you're doing. Welcome back to the show.
Oh, thank you. I'm really honored to be back here and back with your audience.
Well, it really is something I feel to be so crucially important because, and I think we discussed this last time, sort of at the start of the last discussion, if you map out a small change in gut health over the course of a child's life, the trajectory, the impact is so massive.
Yeah.
Learning issues or behavioral issues in their, kindergarten, elementary, middle school, and the psychological impact that can have on a kid is viewing themselves as someone who's an ADHD kid or a behavioral kid, or someone who feels like they're calm and they're focused, or maybe like me, they end up having acne in their high school years, which is embarrassing, and a lot of that can also come back to gut health. So yeah, I'm just so happy you're doing the work that you're doing to help steward parents through how to optimize the gut health of their kids.
Yeah, one of my favorite sayings is from Dr. Alessio Fasano, who has said, "Your gut is not like Las Vegas. What happens in your gut doesn't stay in your gut." And and I love that.
I love that.
It's just so true. And I talk about, and I mean, I know I have my book right behind me, but I talk about the butterfly effect. And that's, there's a Dr. Lorenz, a meteorologist, I mean, way back, I don't know, in the 70s or the 80s, when most of you listeners were really young. I mean, maybe not even born yet, right? And so the butterfly effect, right? Have you heard that saying? I'm not going to get it totally right, but, that a flap of a butterfly's wings in Texas could set off a tornado in, Taiwan, right? And just
Right.
that, like you said, that is so perfect, that one little shift can set in motion all of these amazing ripple effects, that butterfly effect through your child's entire neurodevelopment, immune development, hormone and metabolic development. And here's the thing, I mean, it can be for better or for worse, right? And so, we have to understand the forces that are really contributing to all the chronic disease that we're seeing in childhood and adulthood, but then also flip it, because there's so many things now that people can go online or social media and say, "Oh, don't do this. This is so harmful for you." And great, we have to know what's harming us, but you can't just leave it at that. You have to kind of be like, what now then, right? And that's why, I mean, the work you're doing is so important because, I mean, you're giving patients hope. I mean, I'm working with families, and if we didn't believe that things could change, you and I wouldn't be doing this, right?
Exactly. And I'm looking forward to sharing a lot of the lessons in your book. And one of the ones that maybe we can start with is, and I believe you termed it the insidious harm that our food supply poses. And I was reflecting on this before our recording this morning in terms of so many of the foods that are marketed to kids are exactly the foods that are not good for kids because they're usually processed, and the processed foods have emulsifiers and coloring agents. But obviously, this is a topic we could probably do a whole podcast on. But where would you like to start with a parent and their awareness of the food supply and how that impacts their kids, not only their gut health, but their health more broadly? By the way, if this has been helpful, please comment, subscribe, and share with one person you think this might help.
I mean, what I like to have both parents and kids start with, because kids can really understand a lot of these concepts if we, for of course, the toddlers, we phrase it in a different way than a teenager. But, if we empower kids to help make their own choices, that's how we're going to make change. And that's how, if we start young, we don't have to necessarily nag as much when they're older, because teenagers are going to make their own decisions. And so, and that's part of growing up and learning, but you lay the foundation. So I think really the first step really and truly is, that saying knowledge is power. That is the key. If we truly, as parents and grandparents and educators, if we understood, wow, the ingredients in these ultra processed foods, well, guess what? They're shrinking, parts of the gray matter in your child's brain, or they're directly causing, leaky gut and triggering gut dysbiosis. And the as we mentioned, the ripple effects on their future or even current behavior, attention and focus symptoms, skin health, eczema and acne, or, for girls, their period, painful periods and PCOS and all of that. If we understand that, then it makes it easier to make those decisions to say, you know what, I'm going to look for a packaged product that isn't ultra processed. I may not be able to cook 100% every single thing from scratch at home, but if I buy a jar of spaghetti sauce, or if I buy, a loaf of quote whole grain bread, I'm going to be able to look at the ingredients. My kids are going to be able to look at the ingredients when they're at the store choosing a fizzy drink, or ice cream to have as a snack, right? To be able to make sure that they're choosing things that are serving them. And so, the pushback I get from some is, well, how could you deprive kids like that? Just let them be kids. It's just, why not? It's just a little bit. And here's the thing, in one package of food, it might be a little thing. But when we think about all of the little things that our kids are exposed to, or even as adults, that we are exposed to every single day that disrupt our gut microbiome, and the synergistic, multiplicative effects of those little things. I mean, our microbiomes, they barely have a chance unless we know how to really support the health of it.
Yeah, and I think you make a great point, which is, not a approach that is trying to get processed food down to zero, but trying to be educated in the different foods that you choose. And I always remember this example of two different beef jerkies,
Mhm.
one for which the second ingredient to meat was sugar,
Yeah.
and other ones that have no added sugar. So that right there could be 15, 20 grams of sugar. And then if you combine that with a drink of some sort, right, these things, to your point, can add up really quickly.
Yeah.
So again, it's not to say your kid's going to be in a bubble and only eating food from scratch, which is a nice ideal to strive for, but at least empower them with, what can you look for on the labels? And I'll give my 9-year-old nephew credit. He has noticed that he does not react well. I think it's red 5. There's some food additive that he notices impact. Well, my brother and sister-in-law sort of helped, but now he's pretty good about looking on food labels and saying, "Oh, Uncle Mike, there's red 5 in that. I don't want to eat that because I know I get sort of anxious when I have red 5."
Well, I mean, that's the thing. I mean, because one section of my book is entirely devoted to helping kids learn how to be gut hero food label detectives. And that is something that even for adults, if we can be food label detectives and find out all the tricky, sneaky, insidious, really, I'm going to say even potentially malicious ways that the food industry is changing
Yeah,
our food so that every bite makes us crave more and more, and it tricks our brain so that we are no longer in control of our food decisions because we're gravitating
right.
back towards that pack of Takis that has the MSG and the artificial dyes and the whatever. So when I truly think if we can teach kids how to be savvy food label readers, that is one of two of the most important things I think that we as parents, as grandparents, as educators, clinicians can teach our kids to set them up for success for life. I mean,
Mm,
that is one of the most important things. And if you're listening and you are home cooking from scratch everything, amazing. Like, I'm not saying don't do that. I'm saying it's just
right.
that, right? I mean, that is so good. But even for me as as a holistic pediatrician, it's just not going to be the reality. And, this last week, we had a crazy week. The kids had late soccer games, and it's just not happening, right? And so,
Right.
but if we
Right.
learn how to choose, even like ready, pre-prepared meals or ready, in sauces. I mean, sauces, right? Like, even if we're grilling and we're having barbecue chicken, you bet we want to look at the label and make sure that teriyaki sauce or barbecue sauce doesn't have so many grams of added sugar and the emulsifiers, like you said, and the artificial flavors or anything like that. And
Right.
the added sugar, as you mentioned, the steaks and the jerky. So what's interesting is for the way you can get a lot of the teenagers, especially teenage boys who are wanting to, many of them want to get more lean muscle. Like they're about, they're starting to lift weights, they're starting
My
to work
nephew,
out, right?
yeah,
I
even
mean,
though he's
that's
not a teen, he's always asking me like, Uncle Mike, am I as strong as you yet? Like every third minute,
Yeah,
I feel
yeah,
like.
and you bet kids are like, my son is 12 and he's already thinking about that, and kids start thinking about that younger, and he's in the
Right.
garage, like, lifting our dumbbells in the morning, and I'm like, "Okay, make sure you hold your core in," and all that, but I told him, 'cause of course, it is natural to crave sugar, it lights up our addiction center, and I told him, "Look, we've discussed, how many grams of added sugar is the maximum amount you should get in a day, and we've counted up some days where it's like, whoa, it's, the
Mm,
25-gram limit has now all of a sudden, with the boba tea and going out with friends, has become like 80 grams, right? So I said, look, let's do an experiment. Let's take a piece of steak, muscle. That's your muscle that you're trying to build up, right? Pour sugar on it and just come back in an hour and see what happens. Like, what happens? It turns to mush. I mean, that it's a tenderizer, right? And so for
mm,
for your teenagers who are really, even our young, our female athletes, or not even athletes, but just who want to have more lean muscle and be strong and fit, if you're going and having your frappuccino every afternoon after, soccer practice with your friends, not that you've undone all the benefits of the exercise, but you're not helping. And so we have to help
right.
kids understand what are their goals and how are their choices helping them reach their goals. That is really important if
Yeah.
we're going to help them, be able to make those choices even when they're out of our house and, off to college, or as young adults living on their own, making all of their own decisions.
And I love the way you sort of gamify this, or you put kind of a positive spin on it. And I think that's because you're a clinician, right? And you probably see that when we give kids a sort of fear based frame on this, it's really deleterious. It
Yeah.
doesn't help with the anxiety and depression and fear that I think kids are already confronting with social media and all the other things wrong with our society at the moment. So if we can gamify this with an empowering framework about being stronger or more fit or more lean and kind of a detective, yeah, that sounds really cool. Instead of, the opposing narrative I hear is, oh, this is gluten, it's inflammatory, it's going to harm you. A lot of things that are couched in
Yeah.
fear. And I've really observed with kids, they have much more of a tendency to develop a negative relationship with food. So
Yeah.
framing it like you have in a positive way, I think that's totally the right way to do it.
And it's not just food, it's all the things that kids are being exposed to. Because
All
I
the
think
things.
if
Yep.
we take, I mean, as if we take that gut health, gut first, microbiome-centric approach, it just makes so much more sense what choices you might wanna make. Like, right now, you just mentioned, all the social media and, like, I mean, gamification in terms of digital, the video games. I mean, that
Right.
addiction is just as rampant as sugar addiction. And
Yeah.
what's fascinating is, I've had some parents who have said, that their kids are dealing with a lot of anxiety or depression because we do have a mental health, emergency in our children and teens today. And they've said things like, well, but I mean, the video game it's the only thing that really relaxes them, or, letting
Mm.
them have the Skittles. It's the only thing, that's positive right now. And so if we reframe that and know, well, look, your mental health is 100% intimately tied to their gut health. And we know that kids who eat ultra-processed foods, their gut health, their microbiome, all of those amazing psychobiotics they're not going to stick around to help make the serotonin and the dopamine that you want for your kids. And the same thing with gamers. A lot of kids, I mean, in my practice, who, the kids who are really into gaming, there's so much marketing. There are all these supplements now for like they're nootropics for gamers. I mean, it's this
Mm,
huge industry. And so I have this one kid, he's a teenager, he's done all the research because that's what teens do now. And he's getting on his own on Amazon this gaming, it's like this neon green powder with, I
oh,
mean,
geez.
phosphatidylcholine and CoQ10 and,
Some aracetam probably in there
acetylcarnitine.
of some sort.
Yeah.
Yeah, yeah.
And I said, "Look, I can get you all of those ingredients separately, much higher quality without this gross green." And
Yeah,
it has both acesulfame potassium and sucralose, so 2 artificial sweeteners that directly harm the gut microbiome, but the marketing is really interesting, and so but I talk to kids and parents too that there was once that I was looking at as I was looking at, the teenagers, because teenagers, there's a big void, unfortunately. We have like, the health information for the babies and the toddlers. And then all of a sudden, maybe middle school, but middle school, high school, there's not a lot of information to support teens and their parents. But there was one article showing that teenagers who play video games, and I think the limit was like if they're on even on screens for more than 5 hours a day, and if you look at your screen time, that's actually not hard to do. Their
right.
microbiomes look different than kids who are on their screens
Mm,
less. And the 5 hour mark was in one older study was found to be really the point where the increased risk of suicidal thinking and negativity
mm.
was also significantly increased. I mean, every hour there was an increase, but the 5 was when it really jumped. And so, if we talk to parents and kids about that, again, not like as you said, not in a shaming, look at what you're doing to yourself way, but more like, here's the information. I want you as a teenager, what do you want? You want to be treated like a grown up, right? And so if you want to be treated
Absolutely.
like a grown up, it's time to make decisions like a grown up and show that
Right.
you, as a parent, we can let go and allow more and more of those decisions.
Yeah. And I'm with you. I think putting the child in the decision making seat and giving them that responsibility is one of the best ways to have them be empowered rather than sort of helicopter parented, right? Teach
Yeah.
them, allow them to make the decision based upon logic. I want to be a gamer. I want to have a faster brain. Okay,
Mhm.
let's explain that marketers, classic marketing, they're going to try to get the most money for the least amount of actual viable clinical product. That's just what marketing is, right? You
That's
can
right.
explain that to them. And the sad thing about clinicians is they're usually not good marketers, but they're good at helping people. So this is why
Yeah.
we're going to look at Dr. Song's book
Yeah.
and
Yeah.
follow some of her recommendations because her business is getting your brain as healthy as possible, whereas the green goop gamer sludge is about selling you a product. And I
Yes.
think just helping kids to see that paradigm hopefully will be a light bulb moment for them where they say, okay, I'm gonna be a little more careful not to get sold.
Yeah.
And then they take that empowering, paradigm shift and they make different changes. And one of the threads, I mean, so many great things with what you just said, but one of the threads I think we can pick up on is this concept of neuroendoimmunology. For our
Yeah.
audience, it sounds like a big term. It's a dedicated field of study for many, 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 many years. And it's this interaction between the immune system, the nervous system, and the endocrine system. And there's some pretty elegant studies over the past couple of years showing that what we do in the gut impacts the immune system, of course.
Yeah.
That has an impact on our brain, including our limbic system. And that has an impact on our endocrine system, your adrenal hormone output, but not limited to that.
Yeah.
So if a kid is trying to have better focus and maybe not feel like he's addicted to his phone or feel anxious about whatever it is, a way we can leverage the entire system is by intervening at the level of the gut/immune system correctly. And so this maybe kind of opens up the conversation to how we can set our kids up for success by
Mhm.
this one important lever of their gut health, and it can
Yeah.
impact so many things downstream. Can you
So many
expand
things.
upon that?
Yeah. Well, I think, then it goes back to, well, what is the data on how children's gut microbiomes impact their future development. And
Yes.
as you mentioned, the immune system, even from, of course, babies, but the way that they're birthed, the even, their experience in utero and the way that they're fed initially, that's going to inform how their gut microbiome develops. And we know that there are certain signatures in their gut microbiomes now that we can see um, increase the risk for things like eczema or ADHD or autoimmune conditions. And so we're finding these signatures. And when there's disruption to the gut microbiome, so this one study of nearly 800,000 children, it was a military study,
Mm,
that tracked these children from birth to about 4 years of age, and found that those infants who received antibiotics or antacid medications, which are two immediate disruptors to the microbiome, within the first 6 months of life, had an increased risk of virtually every single allergic disease, like eczema,
mm,
asthma, hay fever, anaphylactic food allergies. There's another study in Denmark, which is, they also keep very good records of their population. And so,
right.
a huge study of mother-infant pairs, and then tracked these infants through time, and found that even just one round of antibiotics at any age could increase the risk of mental health diseases, conditions in that child when they were
Mm,
older by up to 50%. The
wow.
highest risk was when those antibiotics were received even in utero or under 6 months of age. So again, that early
Yeah.
priming.
Earlier,
Um,
the more detrimental. Yeah.
yeah, and then the more rounds of antibiotics, the higher the risk. And so any disruption can then have, like we've been saying, this ripple effect on their metabolic system. The rise in type 2 diabetes in children is
Yeah.
astonishing, and the rise in pre-diabetes, even in these kids, these teenagers and young kids who look fit, they're exercising, they're on sports teams, they're not overweight. They don't look like the prediabetes picture. But when I measure, they're fasting insulin and they're fasting glucose, it's not okay. I mean, their insulin is bumping up against
Mm.
15, 16, 17,
And Elisa,
right?
quick clarification question there. Do you think this tracks, or is it becoming divorced from caloric intake? Because one of the things I've been
Mm,
noticing in adult populations is at one point there was a direct correlation if you were to draw out caloric intake and, let's say, BMI as sort of a
yeah.
crude gen pop screening, they correlated. But now that caloric intake is going down a little bit, or at least it's kind of leveling off, we're still seeing increases in weight. To my understanding, I'm not an expert here, but there
Yeah.
seems to be something divorcing caloric intake from BMI. Are you seeing that same thing in, I don't know how much data, I'm
Oh,
sure there's probably a lot of data looking at this, but have you examined it?
yeah. I can say it in my patients, because my patients are kind of, it's an interesting, more of a, I would say, a quote, select population that
Sure.
comes in who are already a little bit more holistically minded. So I have a very, very small population of, obese and overweight children. But yet I'm seeing this, where these kids, and it's really, I actually haven't tracked their calories, but I don't think it's about the calories. I really think it's about the sugar intake, because now
Mm,
the sugar that is insidiously entering into their diets. I mean, growing up for us, we didn't have Starbucks around every street corner, or boba tea, or all of these. I mean, we had
yeah.
Coke and soda, right? But it wasn't just this, like, it wasn't a social thing to go out and get a sugary drink. And now,
Yeah.
kids and adults, teenagers and adults, I mean, nearly something like 50% of their sugar consumption is as sugar sweetened beverages. And so, and
Hmm.
I know so many kids who are going out. I mean, as a social thing, I love the social connection, but they're going out and they're getting, like maybe a 52 grams of sugar mocha chip frappuccino almost every day. And I mean, that
Because
is
of good marketing, right?
hugely
That's skewing
significant.
sort of how
Yep.
kids think about drinking.
Yeah. And that, of
sadly.
course, is going to directly alter the organisms that want to stay in your gut. I mean, we know about, candida and yeast over, but it's not just that. I mean, that amount of added sugar is going to directly cause inflammation. I think in some rat studies just can immediately cause signs of colitis. And so, and guess what? You disrupt your gut microbiome, you're going to disrupt your gut brain and gut immune and gut, metabolic connection. And so I think it's really that. And the number, when I was training, it was type 2 diabetes was not seen in children. It was called adult onset diabetes. I mean, we just
Right.
didn't see kids with it. And it's just all of a sudden, in the past, decade, a little bit more that, wow, we're having this explosion of kids with, we can't call it adult onset anymore because they're getting it even in middle school. So it's type
Sad.
2 right
Yeah.
now.
And I do want to come back to other techniques rather than antibiotics. Let's say if a kid does have an
Yeah.
infection. I know you've done some wonderful work about holistic alternative therapeutics, but if a parent at this point, or maybe a teenager, not right, let's loop them into the conversation too, who might be listening to this, are saying to themselves, is there something wrong in my gut? How would I know? Are you looking at testing? Because I think there's a argument and counter argument to be made here. Practically, if someone has digestive symptoms, I think to that degree, we can assume there's probably an imbalance
Yeah.
present.
Yeah.
Alternatively, we do know, looking at the research on silent celiac, for some people, they can have active inflammation in the gut that's solely manifesting neurologically, dermatologically,
Oh, yeah.
rheumatologically, so brain, skin, joints. So maybe that's partially a case for testing. How do you look at determining, quote unquote, if there's something wrong in the gut?
So I don't want to sound doom and gloom, but I assume that most of us do have some level of gut imbalance. And I just did a presentation for practitioners on for these forever chemicals and environmental toxicants in children. And
Mm,
these forever chemicals, there are some people, I mean, I forget which reporter called them everywhere chemicals, because even if we're living it, clean and green, we cannot completely avoid them. And I mean, they're already in us. We're exposed to them every single day, and they have, the research is still coming out, but there are significant impacts even in children. I found some literature on the disruption to the gut microbiome from these forever chemicals, and also, I mean, almost all of the endocrine disruptors available. And so,
right.
we're exposed, unfortunately, as a mom. When I was pregnant, certainly I know there were forever chemicals going through the cord blood and through my breast milk, and so we just have to try to minimize that. But we are living in a state of, I think, gut dysbiosis relative to generations past. We've seen the
Right.
steady decrease in bifidobacteria in children and adults, and I think that is one of the most significant factors in how the gut is not priming our immune systems and our brains appropriately. But in terms of, when do I test? I don't always. I mean, as a clinician, over the decades of doing this, I mean, we've been around the block for a while, right?
Right.
You do get these clinical clues. You can see some patterns where you can suspect, certain kinds of dysbiosis, or you can suspect, if you're having some digestive issues, they probably need some digestive enzymes. So there are some things that we can presumptively try, especially for a family who maybe, because unfortunately much of this testing is not covered by insurance, or only partially if you have an HSA account. So I do
Right.
love to test, especially blood work for like nutrient levels, and getting a comprehensive stool test, because you can't really 100% know what the levels are, what's going on, unless you look. But again, there may be some clinical clues that give you an idea that, oh, that maybe this kiddo has some parasites, or maybe this kiddo has some yeast to deal with, or, all of it. And then we can move forward with either a presumptive treatment plan. And if, in a month or two, we're not seeing the needle moving in the right direction, then we do the stool test. Or,
Yeah.
after parents, if you want to start with the stool test right away, then great, because it lets us know where to start from.
Right. And my preference tends to be the former. And I'd be curious to get your thoughts on this, mainly because I try to tread so lightly with a kid thinking they have a thing.
Yeah.
right? Like, oh, I have candida, or God forbid if it's some of the tests, the stool tests, they give you way more data than if we know
Yeah.
that data is actually correct. And you've got dysbiosis, and you've got low acromantia, and you've got leaky gut markers, and the poor kid now thinks that
Yeah.
they're severely ill. So at very least, I'd be quite conservative with my interpretation, and especially with what I sort of share with the child. But what have you seen there? How do you think about that?
I think you're right on, and I think that is also, one of the, I don't wanna call it a fault of functional medicine, because I am a functional medicine practitioner, but for, many, many practitioners, especially when you're starting out, um, you see all these tests and, "Oh my gosh, we can get so much more data on these kids or these adults, and wow, we can help our patients so much more." And yet we're still medicalizing it. We're still often then just
Right.
treating the lab values, not necessarily looking at this patient in front of us. And unfortunately, that is translated into many, many patients, consumers, I mean, whomever, kind of hanging their hat on, oh my gosh, I have MTHFR. That's why I have X, Y, and Z. Or like, oh, I just, candida is, everyone in my family is candida. I don't think I'll ever get rid of it. Or, wow, okay, I have a leaky gut. My kid has a leaky gut. That, how do I know if it's not there? And I'm like, and when you look at the child, if you've done some gut work and they're thriving and their attention and focus is so much better and their sleep is good and they're, getting along with their friends, well, I don't necessarily need to do another test to show that they're doing well. We want to look at the child, right? So I think you're absolutely right. We have to, be careful, tread lightly. We don't want to, identify gut inflammation as, a diagnostic kind of death sentence for like, this is now, your kid's in really big trouble. We never want to do that. And I think even for parents too, because I have a lot of parents who, have they come to me because they've worked with functional medicine practitioners, and they're really worried that, oh my gosh, I think my kid has X, Y, and Z. And I'm like, well, okay, maybe they do, and we can do something about it, right? I mean,
Right.
it's not just like, oh, I'm gonna have leaky gut for the rest of my life.
Yeah. Yeah. Being careful not to sort of overly pathologize
Yeah,
a given finding or the perspective. Let's come back for a moment to devices. That sort of 5 hour ceiling. It's probably like the maximum, it sounds like, because as you were saying earlier, with every incremental additional hour, there's negative impacts on behavior. And in your book, I know you discussed the vagus nerve and breathing. So this, in my view, is a nice antidote to being on devices and sort of gaming. It's,
yeah.
it's really sort of sympathetic, zoomed in, probably shallow breathing. So tell us more about stress, the vagus nerve. It sounds like you kind of gamify this also in terms of giving kids this cool spin in terms of how they look at it. So yeah, what's your perspective here?
So that is, remember I mentioned that there are two things I think if kids learn how to do, it'll set them up for life. The one is reading food labels like a gut hero detective. The
Yes.
second is the second is learning how to regulate their nervous system. I think if kids can master those two things, I mean, really, in fact, if adults could master those two things, so many other things, imbalances, whether it's our HPA, our stress axis, or it's, we have some autoimmunity going on, or, what hormonal imbalances, whatever it is. I mean, so many things will fall into place if we can learn how to do that, and our children can learn how to
Right.
do that. And so, again, starting with the knowledge, because nowadays a lot of kids, teenagers, adults, they treat stress as though it's always bad. And we have to flip that, because in the same vein, where we can't treat inflammation as though it is all bad, there is a role for inflammation. We evolutionarily, we evolved to have inflammation when we are fighting something, when we're trying to heal a cut on our skin, or when we have an infection. We need that. So we can't just say blanketly all inflammation is bad. It's just that, of course, as your listeners know, when it becomes chronic and persistent and we don't have the regulatory parts of our immune system, saying inflammation, you've done your job, that's when we get into trouble. The same thing with stress. So what I teach kids about when they come in and like, I'm so stressed, I don't want any stress. And parents do the same thing. When I show them, or I even draw it for them actually on my little pen and paper. I'm not a great artist, but I try. It's something called the stress performance curve, which, is new to a lot of my patients. And so, on the x-axis, on the horizontal is, the level of stress. And from no stress to really high stress. And then on the Y is your performance level and, low to high. And so here at the no stress, you're not performing well. And we've all had those days, right? Where you're like, oh, I have nothing to do. For a day that might feel great, but for 2 days or 3 days, you're like, now what do I do? When we have no stress, like as parents, if we're handing everything to our kids on a silver platter and they don't have to worry about a thing, oops, they forgot their cleats, for their football game. And we drive back home, 30 minutes to get them, to save them. And they don't, no stress, right? They're not learning, and this leads to low performance, depression, apathy, indifference, right? Then we get to a point where stress goes up a little bit, and here at this peak, we are in the zone, we're performing. We've all had these moments when we are on. You're like, I'm incoherent, I'm so productive, and that's the sweet spot. But then, you have the work stress, the family stress, the friend drama, the whatever. All of a sudden, your stress becomes too high. And then we're in a state of worse performance with anxiety, irritability, chronic problems. And so we want to be able to manage that stress. But here's the thing, most of us are in this too high state. And so when we can learn how to manage that stress, bring us into the right amount of stress, that's golden. And so, when we know that the gut-brain connection involves our stress response with the balance of the sympathetic fight or flight and the parasympathetic vagus nerve response, it makes it easier. So, this vagus nerve response was fascinating. I mean, I just love this. There was one study that found that in children, just by improving heart rate variability. So for the listeners, heart rate variability is a proxy, a measure of vagus nerve functioning. So by improving heart rate variability, that was found to improve not just feeling good, in kids, but actually improve their gut microbiomes. And that improvement was independent of what they were eating. And so, I love that because, if your kids are, have a steady diet of ultra processed foods, of course we need to work on that. But if that's a challenge to start with, then you can work on the vagus nerve. And one of the best ways to do that is really to make it this everyday thing. That's not an add-on. I'm not asking kids to, go to a yoga class or sit and meditate for an hour unless they want to, right? What I am recommending is that kids learn how to diaphragmatic breathe, belly breathe every moment, or in those moments of peak stress, engage that response so that they can engage their vagus nerve. And when we belly breathe, that improves heart rate variability. It improves our sense of well-being. And, that's why the 5 things that I talk about in the book that can help create that microbiome magic, there are 5 things that kids, we are doing every single day. So it's not oh my gosh, I have to do this one more thing. It's like, no, you're doing this already. You have to breathe every day, multiple times, a day. So if we learn how to breathe, that engages our vagus nerve and your gut microbiome, you're going to be so much healthier for it.
It reminds me of this recurring theme in biology, which is a inverted U distribution in terms of too little of the thing or too much of the thing can be a problem, but there's this sort of biological sweet spot. It also reminds me of something that one of my early mentors, Dr. Christopher Kerouac, said to me when I was on an anti-stress kick myself, like, oh, stress is bad. He said, Michael, stress is to life as to tension the strings of a violin. You need the appropriate amount of tension on the strings to be able to play music. Too little or too much, you're out of tune or the strings snap. So I love that perspective. And it also reminds me of a great opportunity to slow down and breathe would be while eating, right? I think there's a tendency maybe to park kids sadly in front of devices to get them to sort of sit and eat. And I just recently got onto a kick of no distractions while eating. If I'm eating a quick lunch, let's say, oftentimes I do so standing up and I'm listening to a podcast and I'm kind of like shoveling food in my mouth. And I've realized, all right, like I'm going to now sit down while I eat, I'm either going to listen to relaxing music or nothing at all and just sort of slow down. And we know this is so good for digestion foundationally, but it's easy, I think, to get pulled into some of these habits for adults and for kids.
Oh, yeah. I mean, it's so important to be mindful when you're eating, and, for families, it's so important that when you can, that you really prioritize the family meal, because it's interesting, there are studies going way back decades showing that spending time during a family meal together, and not just the modern way of like just sitting there each person on their own devices, but really having that family meal together, actually does improve vegetable intake when they're older. But it
Mm,
also it improves academic performance. Fascinating, can reduce the rates of teenage pregnancy, can improve self-esteem, and so many benefits of just sitting
there's a lot of
down.
motivation right there for parents. Yeah. Wow.
Right? And if you don't have kids, then sit down and have a mindful meal with your friends, just once a week. I mean, just it's truly about connection, because even, through the pandemic, the data, the research around the social isolation and the importance of
Mm.
connection for our overall, I mean, everything health, for our immune health, even risks of heart disease and cancers later on. I mean, that connection is so important. And as a family, if you are modeling, this is how we eat as a family, even if life gets super, super busy and everyone has different theater and soccer games and whatever it is. Okay, maybe it's not going to happen every day, but at least it can happen. Maybe Sunday night is our tradition, or, oh, I see on the schedule Wednesday's an open day for all of us. Let's prioritize that. So just prioritizing that, because that way they will bring that with them to their families. I mean, kids and teens who, have that as a model for how to live as a family. Interestingly, kids and teens who also know how to cook and, um, you know, make food for themselves are more likely to prepare vegetables for their families as adults. I mean, that's what we want, right? I mean, just that
Yeah. Yeah.
positive effect.
I mean, so important. I made a new friend here in town the other day, 30 years old and doesn't know how to cook. And it just blew my mind. Like how,
Yeah,
so what that means with no judgment, but there's a, a disappointment as a clinician in terms of that means you are always eating out or
yeah,
processed food. And
yeah.
the probability of your diet being healthy within those confines is super, super low.
Yeah. Well, that is why, I had, because now I opened my practice in 2004, so 20 years, and I had, the past couple of years, this kind of exodus, this movement, I should say, um, of a lot of my patients off to college. And so starting freshman year of high school is when I talk to kids when they come in for their yearly visit. All right, let's think about all the skills you need. You are about to, become a young adult and be leaving the
Love it.
house soon. This is your golden opportunity to ask mom and dad, hey, how do you prepare that, that amazing lasagna that I love? Or if you don't know how to chop, hey, can you teach me how to, prep vegetables? Or,
Yeah. Yeah.
cleaning
Yeah.
toilets and showers is an important life skill. And, knowing how to, do your laundry from start to finish, so it's not always on the floor. I mean, just these things. But one of the most
Yeah.
important things is knowing how to cook. So I mean, I even from like my kids, thankfully right now, they're 12 and a half and 14. And I mean, they've taken on a lot of the cooking. And so like this morning, as I was heading to the office, I was like, look, I have to get to the office a little earlier than usual. Can you guys take care of your own breakfast and packing lunch for school? Which I love doing. Well, I'm actually not gonna lie. I don't really love doing the packing the lunches, because it's just like this thing, like, what are we gonna pack today? But but knowing that they can take it on is such a
Yeah.
relief, because I know they can do that later. So I encourage you parents, if no matter how old your kids are, even if they're toddlers, they can get a little kid knife and like chop up strawberries, to put onto, your
Right.
Sunday morning waffles. You can involve them at any age, and kids who know how to cook are much more likely, even if they're picky, to at least be interested in maybe trying a little bit. And then that little bit just grows.
It's good for everyone, right? The parent has some wiggle room with responsibilities, and the kid feels empowered and like they have more agency.
Yeah.
Let's come back to approaches for acute care,
Yeah.
let's say infections, antibiotics. I think we're all on the same page. Let's be very careful with their use. And we on the podcast in the past have discussed so many interesting studies: garlic versus fluconazole for vaginal yeast equivalency, herbal antimicrobials versus rifaximin for SIBO equivalency, probiotics versus fluconazole equivalency,
Yeah.
and different models of infection or overgrowth. So there's just so many tools here that we can use. The one thing that I think may trip up parents is fear, right? So my
Yes.
child,
Yes.
I really care about them. I don't want to make a mistake. The person in the hospital with the white coat who's really authoritative is saying, well, this is what you have to use.
Yeah.
There's not quite as much discussion of these tools for children. So you're probably the most qualified person to speak to this as a pediatrician who's using these holistic tools.
Yeah.
What should parents know about alternatives to antibiotics or other alternative therapies to use in an acute setting?
Yeah. Well, so, this is such an important topic, and one topic that there's so many things I want parents to understand, and children too. But, in my book, I actually have one entire chapter that I wrote actually for practitioners and parents and kids. That's entirely about what I want parents and practitioners to understand about antibiotics. It's a whole chapter. And then
Mm,
the whole last section, part 4 of the book, is all about the integrative tools that I've learned over the past 20 years to manage the most common acute conditions in kids, and with the goal of helping your kids get better faster, because we know in conventional pediatrics, when your kids are sick, what's there to do? It's just wait and watch, right? It's supportive care.
right.
Or if they're sick long enough, you get the antibiotics. So these tools like homeopathy, essential oils, acupressure, herbal medicines can get them, faster, better, faster, and also have the goal of reducing the use of unnecessary antibiotics. Because in some studies, up to 70% of antibiotics are inappropriately prescribed for children. And
Yeah.
when there's a list of 6 questions that I recommend all parents ask the prescribing physician before they start
Oh, I love
antibiotics,
this.
right?
Yeah, that's
The
great.
number one question is so simple. It's just asking, "Hey doc, is this antibiotic really necessary?" I mean, there's no
Yep.
rocket science to that, but guess what? Some studies have shown that doctors are twice as likely to prescribe an antibiotic if they think the patient wants one, even if they think it's not
Mm,
gonna help, like, even if they think
makes
it's for
sense.
viral indication. And so just by asking that, because I've worked in busy urgent care centers where there are some parents who come in with the goal of just walking out with a prescription. But
Right.
just by asking that question, it is opening the door to have a conversation and letting that physician know, "Oh, okay, you wanna be more thoughtful about this."
And to the doctor's credit, I think a lot of doctors, they're trying to work within the preferences of the patient.
Yes,
And so now you're giving them an indication of what your preference is rather than the clinician just having to guess at what it is.
that's right, and because there is some wiggle room there, even for ear infections, the American Academy of Pediatrics recommends this kind of watchful waiting approach for 2 to 3 days,
Right.
for kids who aren't super young or really sick, and yet, in some states they found that most pediatricians aren't really doing that. But pediatricians know those recommendations. If you say, hey, is there anything, do I really need to start the antibiotics for my child's ear infection? And they might say, and they hopefully will say, yeah, we have a couple of days, 2, 3 days. Here you go. Here's the prescription. And I'll do this with patients too. Here's a prescription. Why don't you, let's wait and see. And you can always start if your child gets worse. Now, in the 2 to 3 days, though, what we want what I want parents to know is what can you do in the meantime, right? You don't want
Right.
your kid to suffer. And unfortunately, ibuprofen, I was reading this one article and I was really dismayed because for fevers and for pain, I'd been recommending ibuprofen over acetaminophen because acetaminophen or Tylenol reduces your
Mm,
glutathione levels, which can harm your ability to fight
mm,
infections. But in this one study, ibuprofen was found to disrupt the microbiome as much as antibiotics. So I'm like, ah. So
Wow.
Yeah. So we still need to support our kids' microbiomes. And when we learn how to use herbal medicines like garlic eardrops and homeopathic medicines like ferrum phosphoricum and use acupressure points like, large intestine 4 and anti-inflammatory essential oils like lavender, I guarantee you most kids, they're going to recover from their ear infections without needing antibiotics. And so that's why I want parents to have all these tools. And as you said, I've been doing this for 20 years. And what we really want to practice is evidence-based medicine, but that term has become skewed. And evidence-based medicine
Agreed.
does not mean just what is in the literature, because we know it can take 17 years, 40 years, for the literature to catch up to clinical practice. And sometimes the literature just isn't there, right? Because kids' research is kind of bottom of the barrel. And so evidence-based medicine is, yes, grounded on the current available research. It's also grounded on clinical experience. So over the 20 years, I've just learned, what works, what doesn't work, what are my top recommendations for most kids. And then 3, as you said, patient preference. So, there's lots of choices here. And so I'm all about empowering parents, because your kids usually get sick in the middle of the night. And so rather than, sitting
Hmm.
there wondering, oh my gosh, should I go to the ER? What can I do? Calling the insurance, nurse line that isn't always the most helpful. It gives you the tools for how I approach exactly what I tell patients, when they have any of these, top 25 very common acute conditions like earaches, sore throats, fevers, colds, flus, vomiting, diarrhea, and, you name it.
Yeah. So just a great resource for parents to have as like a reference to flip to when they invariably get hit by one of these 25 things.
Yes, yeah, yeah. That's what I was hoping for in part 4, that wasn't something to read. Parts 3 are I want everyone to read, and then part 4 is like your bedside reference, like, "Oh, they're starting to cough right now. Okay, flip through to the cough section. Oh, I maybe this homeopathic medicine looks like it might fit, or maybe I'll go get this herb from,
Right.
the local health food store and see if that helps."
And another point I wanted to build upon from your evidence-based comment is there's less funding for natural therapeutics, so there tends to be less data on those. But it's not to say that there's data disproving, and there's oftentimes some data actually proving. It
That's
might
right.
be only one or a few randomized control trials, but there they are nevertheless. And sadly, what happens in some cases I've seen is sort of this arrogant use and sort of commandeering of the term evidence-based medicine,
Yeah.
rather to say, I don't like that sort of healthcare. I don't like natural agents. So I'm going to proclaim that I have the high ground here morally and scientifically and plant a flag of evidence-based medicine. And that's really kind of bastardizing the term,
That's
where
right.
evidence-based medicine should also look at the invasiveness of the therapy. And if it's a more invasive therapy, but it has larger and more RCTs versus a smaller therapy in terms of maybe one or only a couple RCTs, but it's less invasive and less expensive, then at least a therapeutic trial on that agent first.
Yeah.
So garlic first, and
Yeah.
then considering the antibiotic is probably the most evidence-based recommendation.
I love that, and I'm so we're so aligned on so many of these things. It's always so great to talk with you. But, one of the things too is, when I'm looking at trials, even if the quote "natural therapy" proves to be as effective and not more effective, you know what? I'm gonna take that. If a study shows me that walking in nature is as effective at, treating depression as an SSRI antidepressant medication,
Oh yeah.
guess which I'm gonna choose, right? Because we know, the same thing with SSRIs, there are treatment failures, they stop working eventually for many people, and, as I was doing research for the book and really looking at all the different medications that can disrupt the gut microbiome, SSRIs are up there. And what's fascinating, not fascinating, unfortunate is that, for a lot of our kids and adults, they've come to this place of chronic unwellness or chronic disease because of their gut microbiome disruption. And then we're piling on medications like, maybe long-term antibiotics or steroids or SSRIs or antihistamines and reflux medications, all of these meds that have been shown in the research to disrupt the gut microbiome. So we may be getting some temporary relief, but I think for a lot of the time we're trading the short-term relief for long-term, maybe worse outcomes. So not to be scary for any patient or child who's on these medications, but just to say you got to work on the gut. I mean, even if you're on these medications, you still have to work on the gut and support the microbiome if you're going to have the best chance at either weaning those medications, or if the medications are helping you, great, but they stop working at some point, a lot of them. So having that microbiome foundation is going to ensure that you're just going to keep moving forward.
Yeah. I mean, so well said, especially when thinking about depression and anxiety and how you really do, in most cases, seem to be kicking the can down the road. And if you don't fix the problem in the gut, as someone who had depression from a gut issue, I am so glad I determined the gut cause and didn't get put on an antidepressant, because behind that, then there comes issues with libido or sleep or maybe energy. And sure, I'm not making the claim that there's never a time and a place. If someone's in a really dire strait and they just need some relief, sure. But to be looked at in that veil of a short-term palliative measure, while we very importantly do something in concert to resolve the source of the symptoms. So yeah, I agree with you. It's always great talking. We're very like-minded in that way. And I'm sure our audience is sort of, nodding their heads in agreement, because this is what we're all, I think, on the same page about. How do we get as healthy as possible, literally from the inside, the gut out? Where can people learn more about the book? Any other resources you want to point them to? I'm also curious if people are saying, love the book, I'll buy the book, but I may also want to do a telehealth check-in. Is that something that you're offering at your clinic?
So yes and no. So the best place to find me right now is on my blog, healthykidshappykids.com, and on Instagram, which is healthykids_happykids. And the book, which is right behind me, my book baby. It's literally my life's work for the
It is
past
like a
20
baby.
years.
Yeah.
Yeah, in the book. And it's healthykidshappykids.com/book is you can find out more information about the book. But it is available at any major retailer, Amazon, Barnes & Noble, Books A Million. If you can order it through your small local bookstore. I mean, we want to support our indie bookstores for sure.
Love it.
And then I am, full disclosure, I am on the medical board of Tiny Health because they are the really and truly, in terms of the infant and toddler microbiomes, we know that the microbiomes of babies, up through maybe about 3.5, 4 years of age, there's different stages of microbiome development, and each has a different quote optimal signature, and it's in those stages where we can see a signature being set for future risks for eczema or ADHD or whatever it is. Once kids are 3.5, 4 and up, then doing the same microbiome testing that you might do for yourself, like Doctor's Data, Genova, GI Map, all of those can be useful, but there aren't really, Tiny Health is the only one that's been doing tons of research, even working with academic centers and, NICUs to cull this data to get infant and toddler pediatric specific markers. And when they first started out, they were just a, microbiome analysis. What is the composition of all of the bacteria, archaea, yeast, viruses in your microbiome, which is so useful. But when I got on board, I said, look, I want to make this even more useful, because I would like to see functional markers. What are your short chain fatty acids? Is there inflammation in the gut? How is this child absorbing and digesting? So now they have that professional. It's called their Pro Kit. The microbial analysis any consumer can order on tinyhealth.com. The Pro Kit has to be through a practitioner, and that's kind of the tricky part. I mean, I've offered, just this past week, the opportunity for some folks who are not my in-office patients to purchase a test and do a group analysis. So it's not a one-on-one, doctor-patient relationship, but really, here's your test. I can get it for you, but we're going to analyze it as a group. So I will hopefully continue to do that, because it's been really, I've been asked for that. I think also, Rupa Health is going to be offering Tiny Health the Pro test soon. So, but like I said, and like, Dr. Ruscio and I just said before, if you start with the foundations, I always think, even if there's gut dysbiosis or leaky gut or inflammation or whatever it is, you have to get back to the foundations. You have to get back to the way we're eating, the way we're breathing, the way we're living that is supporting our gut microbiome. And that's like, parts 1 through 3 in my book. Like, what are the foundations? Because, if you're trying to, it's not just about like, oh, there's, some Klebsiella in the gut. Let's just, take an antimicrobial and kill it. Sure, maybe you'll kill it. But guess what? That or something else is gonna come right back if you don't have those foundations. So
Strongly
w
agree. Yep.
right?
Love it.
So why not start with the foundations of an optimal gut microbiome, work on that, see where you get, because guess what? Prebiotics can kick out that Klebsiella, on some prebiotics. There are some, just by eating fermented foods that can optimize your gut functioning. And it's all, setting in motion how we can make sure that your gut's ecosystem is the most thriving ecosystem. So all of the good bugs want to come and make it their home, and the bad bugs are like, this is not a neighborhood I want to live in. Let's move out. And so it's you gotta have the foundation. So, do I start with the test first? Not always. And for sure, if you don't have a practitioner, then great. There's so many other things you can do.
Love it. I love that approach. Well, Dr. Elisa Song, you are a wealth of knowledge. I appreciate the work that you're doing. Folks, check out the book. I think this is obviously an amazing place to start. And then also, you have that chapter 4 as your reference guide for when there's the vomiting, the diarrhea, the earache, whatever, the things that you don't want to have, but you'll probably encounter at some point. And again, just thank you so much for your work and for taking the time.
Oh, thanks for having me.